for the Economist Corporate Network. Welcome. Jeff Astle is the Managing Director of our Shanghai office. Paolo Compostella is our Managing Director in Italy, and I'm sure many people want to hear from him. And so is our friend from China. Chris Levy is our European Director for APCO Insight, which is our research arm of the company. And Nick Labuschagne, he is our Head of Strategy and Crisis Communication, and he's our part of Global Crisis Team. Today's discussion is joined by more than 100 people right now. So welcome, everybody. And I'm sure it will be a very exciting and very interesting, informative discussion. I want to also highlight that APCO and The Economist will be presenting findings of our research on the topic for the very first time. So there is new data about how the market is behaving and responding to the coronavirus. So there is a lot of food for thought here. We will be spending approximately 30 minutes. Everybody will be saying a few words, presenting the research, giving their input, and then we're going to open up for Q&A. Before I move forward, I'm going to ask my colleague Uzma from London. So thank you, Uzma, for joining. It's 7 o'clock in the morning there, and to tell us what are the rules of the webinar.
Sure. Hi, everyone. Ground rules for today. If you're an attendee, you'll be on mute with no camera access. If you'd like to ask a question during the Q&A session, you'll have a raise your hand function on Zoom. If you could just raise that, and we can let Mamoon know who's asking the question, and we'll unmute you. If you're joining by phone, unfortunately, you won't be able to ask a question, but please send it in by email, and we'll check it and get it asked during the session.
All right. Well, just a quick introduction. APCO Worldwide is an advisory communications firm that supports governments and supports corporates across the world. My colleagues have been working on the front line, first with clients in China, then South Korea, Japan, and of course Italy, and more now increasingly so here in this region and the United States. Ladies and gentlemen, we actually now live in a place, we call it the unknown unknown. And we really don't know much. We try to figure it out. We try to understand in order to be able to deal with it. So this is the place we are today. We believe we are in the unknown unknown. The virus is spreading so fast, more than 200,000 cases and more than 8,000 deaths. The coronavirus has become a major factor in all of our lives, especially over the past 12 weeks, and we don't anticipate this going away in the next 12 weeks going forward. Let me just ask my colleague, now we will start with our colleague from The Economist, Rob Willock of The Economist, and he will give us some analysis and headlines on how the countries and governments responding from an economic policy. Rob, over to you.
Thank you, Mamoon, and hello everybody. Good morning, afternoon or evening, wherever you are in the world. Mamoon, I think you are driving the presentation, right? So I'll ask you to move the slides on at the right moment. There are a few slides here and there's lots of information on there. I don't have time today to go through it all in great detail, but I'm sure these slides will be shared with you afterwards. So and perhaps we can get into a bit more detail in the Q&A session. So look, just to say, to follow up what Mamoon introduced, 2020 already started as a pretty tough year, as you can see from the covers of The Economist so far. So up until recently, the US-China trade war was pretty much all we were talking about in terms of risk. And that probably still is the biggest risk to our forecasts in the long term. But in the short term now, COVID-19 is really has really overtaken everything else as the main concern. So if I could ask you to move on the slide, and really the question we're all asking now is, how bad will this get? How bad is it right now? Well, you saw the numbers shared on the earlier slide, and for my part, I keep an eye on this every day on the Worldometer's site. There are many of these tracking the growth of the pandemic. China, Italy, Iran, Spain, Germany are the main places of infection at the moment in terms of overall numbers, but I think it's important to look at the percentage of populations being infected, and in that regard, places like Italy, Switzerland, Spain, and in our own region, Qatar, have significant incidences of the infection. Interestingly, infections themselves are not a great measure, simply because that requires us to look at testing as well as incidences, but deaths are obviously an easier and much sadder measure, but also pay attention to recoveries and pay attention therefore to the number of active cases. But certainly for us, the variation in the mortality rates in some countries does point to what we consider to be a significant underdiagnosis of the cases of COVID-19. Now, while China's getting back to work, many other countries are at a much earlier stage of their epidemic cycle, and of course they face a very difficult choice, whether to let the epidemic run its natural course and peak quickly, or to spread it over a longer period with social distancing measures. And the trade-off there is between health outcomes and economic damage. So again, Mamoon, if you can move on the slide. We created last week a number of scenarios ranging from optimistic through baseline, pessimistic and nightmare. Well, optimistic you can already forget. In the space of a week, I think we can also say that we've moved beyond baseline now and into the pessimistic scenario. So we're now looking at sustained person-to-person transmission. We're looking at a peak in mid-April. And this is why some governments are trying to delay the implementation of their quarantine measures. But large regions are going to need to be quarantined, and healthcare systems are going to be severely strained where they're not already so. Parts of countries are going to be able to continue functioning, but at limited capacity, but most borders will be tightly managed or indeed closed. We now expect the virus to infect 20 to 50% of the global population of affected countries, and the death rate will be around 2% on average. And a commercial vaccine, we think, will be ready by the end of 2021 at the latest. We will, we think, see the virus become a seasonal disease which flares up each winter. The nightmare scenario is not pleasant. I won't talk you through that now unless we have questions later, but you can see some of the headlines there on the slide. Now, it's not purely the economic impact of government measures that are affecting businesses and consumers. Sentiment is playing an important part, and last week on March the 9th, we saw stock markets fall sharply. We saw the price of oil collapse by nearly 30% in one day, and those trends have continued. Oil is now under $28 a barrel, and of course that is not great for the MENA economies. The market has been hit by fears that global oil consumption will contract, but also, of course, by the surprise oil price war initiated by Saudi Arabia and sparked by OPEC's failure to persuade Russia to cut production to slowing demand. Now, this is a very fast-moving picture, but if I can ask you to click again, there we are. These are our new global forecasts for 2020. You can see they're highlighted in pink. I won't talk you all the way through those, but the highlights are we now have global growth standing at just 1% this year from 2.3% before the outbreak started. And that really is now recessionary territory. Most economists talk about global recessions being anything under 2%, so we're deep into that. We expect that at least 4 of the G7 economies, France, Italy, Germany and Japan, will experience a full year recession in 2020. And in the US, we believe now that GDP growth will be at just 1% this year, down from 1.7 in our previous forecasting round. And we expect China to drop to 2.1% this year after a very steep contraction in output in the first quarter. The Eurozone will register a full year recession this year, minus 0.5%, as output of the bloc's largest economies contracts. For inflation, we think that demand dampening impact of the coronavirus will prove greater than the supply shock. So we've therefore revised our global inflation forecast somewhat downwards. And we think that trade disruptions will be severe in the first half of 2020. So our global trade forecast is just 0.4%, down from 2.3. We think there will be a rebound in trade links in the second half of the year, but risks are still very much on the downside. As for oil, our oil price average forecast for 2020 is now just $45 a barrel this year, and we have those recovering to about 53, 54 in 2021. Mamoon, if I could just ask you to click again, and I'll just have a quick look at regional forecasts. Apologies for the pace, but I think I've only got 6 minutes and I'm probably already through most of that. These are our new regional forecasts, the new baseline scenarios. You can see Saudi there at 0.5%, but with serious downside risks into negative territory. UAE 1.2%, big question mark, big elephant in the room. Is Expo going to happen? We can talk about that later. And of course, Iran already under severe pressure from trade sanctions, facing a very difficult time at the moment with the outbreak, with very large numbers in terms of what's measured, but probably much steeper and deeper in levels of infection than are currently being reported. Now, GDP figures are all well and good, but of course the dashboard of indicators we should be caring about right now are health outcomes, business failures, unemployment and income losses, particularly for flexible workers. So GDP is a nice round number, but in terms of the impact on people, those are the other things that really matter. So we undertook a snapshot survey of Economist Corporate Network members and EIU subscribers in the Middle East. So Mamoon, if I could ask you to move on the slide. And you'll see just some headline figures there from the survey. I paused the survey yesterday afternoon to pull these figures out. The survey is still ongoing, but these were the figures as of about 6:30 p.m. yesterday. So impact on business. You can see there that the impact on business is going to be somewhat negative for about 2/3 of respondents, but strongly negative for a quarter. 40% of companies in the region have already downgraded their business outlook for 2020, and 40% more expect to. In terms of length of disruption, the most common answers are 1 to 3 months, but many more are suggesting that disruption will last 4 to 6 months, and of course that will really depend on the length of the infection process in the region. Very briefly onto the next slide. What we're seeing from business leaders are some quite worrying stats here. Around a quarter are having to make redundancies among their workforce. Large incidences of paid leave, but also unpaid leave, and that will depend, of course, on the sector, but certainly anyone involved in travel, hospitality. We know that there are large-scale unpaid leave processes taking place. And also people deferring investment projects. That was the largest of those numbers, so more than half of organisations deferring investment projects. My last slide is just an interesting one in terms of people's concerns. If that's a complicated slide, let me just talk you through it. We asked people about their own concerns about personal health, family health, health of employees, and so on. You can see there that people in business leadership positions are less concerned about their personal health than the health of their family, health of their employees. Perhaps because they are business leaders and probably reasonably well paid, their family's financial security is perhaps less of a concern to them, but nevertheless it is still a grave concern for many. Business prospects for the region, prospects for the globe get worse as you go along. So people reasonably concerned about prospects for their business, more concerned about the prospects for the region, and greatly concerned about the prospect for the global economy. That was me very quickly. Perhaps we can come back to some of these points in the Q&A. I'm sure I've used my time up, but thank you very much for listening.
Thank you very much. Very useful and information, Rob, and I'm sure people will have questions about this. And now I'm going to invite perspectives and lessons learned from two of the hardest hit countries in the world. Jeff Astle, our colleague from Shanghai, will share some lessons learned from China. Jeff, over to you.
Thank you, Mamoon. Good morning, everybody. Good afternoon here from Shanghai. I just want to talk about Shanghai and then a little bit also about Singapore, and I will talk about the context, what happened, what's happening now, and then maybe a look into the near future. For context, I think Rob alluded to it, that last year was all about the US-China trade dispute and the impact that was having on the global economy, the impact it was having here in China, US-China relations. the virus seems to have provided another form of rhetoric between both sides recently, with Chinese government sending messages saying it could have been sourced from the US Army, visits to China, and then Trump and Pompeo recently, and Trump again today, calling it the Chinese virus or the Wuhan virus, which has been taken, as you can imagine, quite badly here. I think China and Singapore, I'll talk about, have been well prepared in the sense that they've been through similar crises with SARS and H1N1. And so whilst I think there was obvious initial criticism about the cover-up and the lack of sort of initial ramping up of activities centered around Wuhan and Hubei in the early part of January, once the national government got involved, things happened very, very quickly and ramped up very quickly here. And despite those initial issues and perhaps criticisms of the government locally and nationally, since January, it's been impressive, and the people's feedback and responses has been that the government here has been handling it very well, with efficiency, with coordinated efforts, regular communication to contain this. And we'll talk about the numbers in a little while. Contain this very much to Hubei province, and the spread around the rest of China has been very limited. To the extent that, this is often now called the China model in terms of the speed, efficiency, and resource deployment that's taken place to contain this. I think Chinese government is also, trying to do its part now, and China's, as it may be coming out the other side of the worst of this crisis, looking at how it can help and engage with other countries, particularly Italy at the moment, and obviously working with the WHO. From a business perspective, the government is now very much engaged in liaising with foreign businesses here, looking at ways that they can offer support, incentives, subsidies, opportunities to help re-stimulate the economy, which is obviously seen, and as Rob alluded to, quite an impact in the short term, and they don't want that to see that continue for a longer period of time. I see that there's sort of five stages of this crisis. There was the kind of local outbreak and uncertainty and confusion, poor communication, underplaying of that impact, through to when this disease began to spread rapidly, and attempts to contain it with a little bit of chaos and misinformation and uncertainty, which is, I'm sure, what you're experiencing now in other parts of the world. Then government serious action, travel restrictions, lockdowns, quarantines, closures, ramping up of testing, and then into that phase that we've been going through, which is kind of containment, managing the healthcare capacity, improving information flows, good tracking, and a slowdown, to now where we are in stage 5, which is a drop in cases, significant drop in cases, and that attempt to ramp up to near normal as we go forward. So lessons learned. The government, as I said earlier, was maybe a little slow in the initial stage at a local level, but once the central government took over, the initial stage at the end of January was the State Council extended the national holidays that were going on in the last week of January, encouraged it for another week, encouraged people to stay at home, stay where they were, not travel back if they were traveling from family homes to cities. Travel restraints and tracking was put in place very, very quickly. People were encouraged to wear masks and stay indoors, all within the space of a week. So that by the first week of February, we were all in stay-at-home mode, checking and restrictions in and out of districts and compounds, factories and business closure, all stores closed except groceries and pharmacies very early on, and limited travel options. And you've all seen, I'm seeing the sort of the scale up of the healthcare operation within Hubei province. We've now been in that situation for 6 weeks. Lockdowns, quarantines, business closure has continued. I think also of note to say is impressive is the implementation of digital communications, app-based solutions to track us and track cases, to warn us if we've come into contact with any cases, and to help people to go about their daily business in some kinds of safety and security, and to keep regularly informed. Businesses, we've worked with a number of clients here in China across a number of sectors around this crisis: retail, consumer, manufacturing, and technology, helping them with a lot around employee communications, internal communications, local government engagement, tracking the issues as they're in real time, scenario planning, obviously. And now we're into the phase of re-engaging with government to look at the long-term implications, the new policy and regulatory implications, subsidies, incentives, the stimulus packages that are coming through. Some of the best practice, you can't do enough in terms of talking to your employees and demonstrating constant communication, empathy, support, helping them work from home, being flexible, understanding, making them feel that they're safe and secure in their jobs, setting up a global crisis team, learning from what we've done in China, working with local governments to adhere to their policies and support them as wherever they come. There was a phase where people were making donations and support and commitment to efforts in China, and businesses here have been sort of stressing an emphasis on in China, for China messages, and demonstrating their support. Where have we got to? As you probably know, cases over the last week or two have stabilized around the 80,000, and our death toll is around 3,200 at the moment. We're seeing only a handful of cases every day. In fact, today's news is that there were no new domestic cases at all in China. We had 35 cases, all imported from people traveling from overseas back into China, which is where we probably are at now looking forward. In terms of activity, only 2 weeks ago, we were, if you look, walk the streets of Shanghai, the place was empty, businesses closed, roughly about 20% of day-to-day activity going on. I'd say now we're at the sort of 60% day-to-day activity going on, with most businesses reopening slowly, step by step, loosening restrictions, encouraging people to go back to their daily business. But I think there's probably another 2 or 3 weeks at least until that sort of returns to normal. What's the impact?
Go ahead. If you give us your last statement here, Jeff.
Okay, sure. What's the impact? As we heard, GDP probably negative this quarter, certainly impacting forward over the next 2 or 3 quarters. And what is the long-term impact? We'll have yet to see. I think both for Singapore and for China now, the risk is about being caught by those returning from overseas. More cases in Singapore recently from overseas, and more cases now in China from those returning overseas. So there's that risk of it going full circle and coming back to impact China and Singapore. Thank you, Mamoun.
Thank you. Very useful, Jeff. I would like to turn now to Paolo Compostela, and where the situation, to us at least, seems out of control. Paolo, please tell us your view on what's going on in your hometown.
Of course, and thank you, Mamoun, and good morning to everyone. In Italy, we are right in the middle of the emergency. The outbreak started about 4 weeks ago, and it has become obviously quite serious. By tonight, Italy will probably surpass China in the number of casualties, over 3,000, with a national lockdown that is affecting 60 million people. And it is the lockdown in particular that is impacting all types of businesses to a great extent. To summarize, in the few minutes I have available, I would like to touch on mainly on 3 points. What were the most immediate needs that corporations had in the first few weeks after the outbreak? Then giving you a few examples of how large companies reacted, mainly from a communication and corporate responsibility perspective. And finally, touch on some lessons learned. So on day one, the immediate concerns of the company were mainly around internal communication needs. These impacted literally everyone. Within the hour, the leadership of those companies, often with thousands of employees on the ground, had to make decisions effectively over the health and safety of the staff. So healthcare guidelines, teleworking policies, protocol for emergency that most companies didn't have, guidelines to use office space, and a long series of business disruptions to manage. Additionally, all customer-facing businesses, such as retailers, supermarket, logistics, transport, had the additional burden of completely reorganizing their business and let the stakeholders know about it through external communications or direct engagement. The main challenges were certainly the time pressure. You need to consider that most restrictive measures have been introduced by the government suddenly, sometimes late at night, and effective immediately. So the HR and communication teams literally woke up one morning in Italy with new rules to follow and hundreds of requests for information from their staff. Any minute of delay proved to be problematic because when it's health related, people get vocal almost immediately. We saw that on internet, on internal social networks, and even publicly on Facebook. Then, as the day passed, the new emergency for companies were related to navigating the new rules and the business needs. So you can imagine the transport of goods, moving all types of material and people, keeping social distance, and communicating to all stakeholders involved. Again, the problem was certainly timing, but also preparedness. We saw very clearly that those companies with strong, HR and communication teams on the ground were certainly more resilient, especially if they had staff with hands-on crisis communication experience and local language, if that became an element too. Other companies, more customer oriented, including, for example, the biggest technology company around, often they didn't have people on the ground at all, and sometimes even in the same time zone to engage promptly at a moment when many fronts were open and the top management needed quick but reliable information to make decisions. In essence, we saw a very direct link between the level of internal culture and how engaged the staff is and the effectiveness of the company's response, with greater risk reduction for companies that are used to do some substantial internal communications and, for example, had tested processes in place. Finally, I would like to touch on quickly on the lessons learned, what worked and what really didn't work so far. The main thing is we noticed that in emergencies like this, communication clearly has to follow, has to support and protect the company's reputation, but has to come after other initiatives. At time of emergencies, people are not really interested in bold statements, in positioning exercise, storytelling, but they really wanted to see action. But if you manage to deliver an impact, then the reputational gain is very strong. We saw all types of companies' activities. We saw supermarkets offering free delivery of food to people above 65 years old, production lines for face masks put together essentially in a big day by entrepreneur. The pharmaceutical industry, those who could offer drugs offered them for free right away. But even more interesting, some converted large industrial production lines to manufacture quickly disinfectants, then to donate to hospital and local communities. We read reports yesterday also of a French luxury company, very, very famous, that also announced the conversion of a perfume factory to produce disinfectants. Then we had a food company donating energy bars distributed for free to healthcare professionals. We saw the hospitality industry offering free accommodation to doctors and nurses. As Jeff noted, some Chinese companies were very, very prompt in reacting and offering all sorts of useful medical equipment, including the Chinese government sent two planes full of medical equipment to Italy in the last few days. Then on the Italian side, on the local side, all large industrial groups, especially if deeply rooted in the territory, donated large sums in the tens of millions of euros, most typically towards boosting the healthcare reaction and of the authorities and of hospitals. And then there has been the last category of high net worth individuals, like its famous former Prime Minister Berlusconi donated 10 million euros, and several other people did the same. To be noted is that the risks with communication, however, were also very high. Because of course this emergency is the very heart of public debate. We are seeing terrible numbers coming up every evening, and there is no other topic in all media, and there have been a lot of communication efforts that also backfired, with some, including some epic fail that frankly won't be forgotten. So to conclude, my last point is that if this crisis brought disruptions to all industry in one way or another, for some companies though it did bring also additional business, which is strange, but it happened. Pharmacies, for example, saw all their sales going through the roof. Online delivery grew by 4 times in Italy. For those companies, the initial reaction was really more complicated, because it always carried the risk of being seen as taking advantage of the situation. That is really not a message that anybody wants to send. It would have a serious reputational impact. So my recommendation to conclude is always be very cautious especially with forward-looking statements or advice, because we keep being at a time when uncertainty over the future is very high. So it's a good recommendation to think twice before coming out with external communication. I think I'll stop here for now, and I will be happy to take any questions. Thank you.
Thank you very much, Paolo. I mean, I know you guys are facing probably the biggest difficulties worldwide, and let's hope we'll see Italy turning the corner like China as soon as possible. Now, I would like to invite Chris Levy from APCO Insight team, our own research and intelligence arm. Chris will share several high-level findings from a just released APCO poll in this region. We've conducted the research in 3 countries in this region to gauge the public's attitude towards the COVID-19. Before you start, Chris, I would like to remind people that you can ask questions, and we'll try to answer them as soon as we finish.
I will be brief to leave plenty of time for the questions. Thanks, Paolo and Jeff, for the perspective, very valuable perspective from 2 countries at the heart of this. And Robert, that was very interesting to see the fresh polling you had from business leaders. As Mamoon says, I'd like to complement that with some recent polling from Bahrain, UAE, and Saudi as well. Before I do so, just to stress that obviously the situation is very fast moving. So this polling was completed on Tuesday in those countries. Things may already have moved on slightly from there. And you'll also see some reference points from the US. Now, this polling was carried out a couple of weeks previously. So please don't regard this as being directly comparable, but I include it here for the time perspective as much as for a geographical comparison. So to talk just a little bit about the results now, and reflect on what it means from both a practical and a communications perspective. First thing we saw is, as you would expect, there's a high level of concern. So you see up to 80% in Bahrain, they're saying that they are extremely or very worried. There's been a variety of polling across the world on this. This figure of 80% is about comparable with what we've seen in some Asian countries as well. So it's high. But really, the fact that the point that I want to pull out here more than anything is more on the right-hand side. So the challenge that we see when we combine results across UAE, Bahrain, and Saudi, so that's over 1,000 respondents altogether that we're looking at here, is that the level of concern, that is worry about getting the disease, is what we're talking about, the question we asked here, is lower amongst that 16 to 24 group. Naturally, this reflects what people have heard about symptoms being milder amongst that group. But the challenge is getting people to understand that even though the risk is less for themselves, they present a risk to family and others who are older, more in vulnerable groups, and are going to suffer much more on average if they get the disease. So that's really the concern, getting the message across there. If you move to the next slide. We also wanted to look at the level of awareness about what happens. If you're infected, but also how much people know about the symptoms of the disease, so what to look out for, and how to prevent it as well. So we asked people how much do they know about COVID in these 3 areas on the left-hand side. Figures that you see are those who said they know a lot. So there are some people out there who still said they think they know something about this, what this shows is there's still considerable room for education on this, despite the saturation of coverage that there is around the disease. So symptoms in particular, you would want people to know more what to look out for and when to be particularly concerned. Preventative measures, of course, from a public health perspective, we want that to be maximized. But what I'd like to spend just a little bit of time talking about here is on what to do if you think you might have it. So the right-hand side are the figures that you have there. Now, obviously, the official advice varies somewhat country to country. I believe in Saudi, the advice, or at least as of a couple of days ago, was to go to the medical center or emergency room. But in Bahrain and UAE, it is more as the initial port of call to call the public health office. So it's a little bit concerning that you have quite a large proportion of people there who are saying that their first port of call would not be to do that, but would rather be to go to the emergency room or just to go to the doctor's office or clinic. So there's clearly a little bit of work that needs to be done there to get the message across on what the official advice is to do if you suspect that you have it. Moving on to the next slide. This is what people are saying that they have already done in response to the disease. So we asked a question, what are the precautions that you have taken or will take to prevent COVID? And what we've taken here are just the figures for have already done. And what I want to highlight here is the numbers who are saying they would stay at home or avoid others who might be sick. Now, in most countries, you're having a majority of people who are saying that they're doing that social distancing. However, it's about 30% in best case who are not. And again, you would still want to see that being increased a little bit. What's more positive is that the basics, so the hand washing, covering your mouth when you're sneezing or coughing, we're seeing high proportions there on the left-hand side who are doing that. Moving on to the next slide. Where people would look to for information. And I think 2 points to make here. This is information on the virus in general. First point is from an employer-employee communications perspective. What people are not looking in the main to companies to do is to be a source of advice. We'll get in a second to what they are looking to employers to do. But people more are looking to official sources, be that their health ministry, the WHO, and really the role of social media here, both in general and government social media. So social media is clearly an excellent tool for official sources to get the message out. And that's especially important given the wider social conversation, which does sometimes present some dangers of fake news or rumors being spread in general. And lastly, I'd like to end by looking at what people are expecting from their employers. If they're not really expecting them to be a main source of information, really what they want their employers to do. I think both Paolo and Robert were touching on this when they were talking about their experience, is to take care of them, getting those basics right. So if you are having to be in the office, it's increased cleaning, hygiene and preventative measures. If you don't have to be in the office, then it is either encouraging voluntary working from home or making that mandatory. So really, as an employer, what you should be looking to do is just get those absolute essentials right. And on that note, I'd like to end, and I think we're going to look for questions, Moin.
Thank you very much. Very useful research. If anything, if companies and friends or government officials who are on this call looking for what is the opportunity here, what can we do to help, it's clear. The one key area, and I think the most important area, is to educate people further about how to see their symptoms and how to react to them. So if if the spread increases, we do not overload the healthcare system. I think that's the most important point I see personally from this research. So thank you. Please send your questions again. We will try to finish as soon as possible because we have not much time left. Nick, our head of crisis communication, will give us a practical advice on managing this crisis if we can. Nick.
Good morning, everybody. I think one of the things to remember here is that this is a crisis that is unique in many, many different ways. Clearly, we've never had something of this magnitude before. But where it is different from managing even major global crises is this is something that involves every single one of us. Typically, a crisis would ultimately have some kind of ring fence around it. So you would have people involved and people observing from the outside. That is no longer the case. The World Health Organization has made very clear that the only way for us to deal with this at this stage is for us to break the transmission chain. And I think going back to what has been said through the research and what Mamoun has just said, our primary job, being totally involved in what is going on right now, is to help the public health authorities to do just that. And there are really only two things we can do. The first thing we do is explain to people about social distancing, and the second we do is explain to them about the hygiene behaviors that we have to adopt in order to break the transmission chain. And in that sense, when you look at the kind of communications that corporations in the region have asked us to do, that is exactly what is happening in this part of the world. So if I can go back about 3 weeks ago, the first calls we got were literally for help, make some sense of what's going on, help us plan for what is happening. Then it was in terms of helping with messaging. You know, what do we say and who do we say it to? And then find out what is happening with, excuse me, it's my home printer. And then ultimately to find out how to recover from the situation. What we have as a major challenge in the region is the fact that we're dealing with multicultural organizations, unlike other parts of the world. Look at China, look at Italy, look at the United Kingdom to a large extent. Most of them have homogeneous cultures and populations to a large extent. We in the Middle East have, in some cases, up to 120 different nationalities, multiple cultures and religions. And communicating with these different cultures is a massive challenge. One message will not serve all target audiences. And much of the work that we've been called upon to do in the region has been to help our clients craft the messaging specifically for their different cultural groups in their organizations. And I think this is something that organizations can go the extra mile on. We've got a responsibility to communicate to these folks, but we need to do it in a way that resonates with them. Humans are generally quite poor at understanding risk. And particularly different groups look at risk differently. I'll give you a simple example. Some of the groups we're dealing with in the region are resistant to communicating until they have all of the information. They're afraid of making mistakes. They're afraid of being called out by the authorities. That is an indication of what we call a worldview that reflects honor and shame. But their target audiences might have a completely different worldview. They might be terrified of what's going on and need the information, but it's not being provided. Our job as advisors for these clients has been to explain to them how they need to craft their messaging and the frequency of the messaging for their different cultural groups. So I think in terms of where we're at on the cycle, you've heard from Paolo and Jeff, we're a couple of weeks behind the curve. We're just about to go into it. We're very fortunate that we have the experience of our colleagues to rely on and to be able to translate that into the region. And we look forward to being able to help you all in dealing with this unprecedented crisis. Over to you, Mamoun.
Thank you very much. We have overrun our time in terms of presentation. We have less time for questions, but let's get moving very quickly. Before we start questions, I just want to make a clear a viewpoint for myself, for everybody to think about for a minute. The world varies and functions differently from one country to another. in a functioning democracy, like in the Western world, people are wired to question behavior of government. Whereas in this part of the world, especially the countries that we have surveyed, people have extremely high confidence of their governments. And I think the same case in China, in a sense that people do follow instructions and people do listen, and they do believe what the government tells them, which I think will have a much more meaningful impact in resolving this issue faster than anywhere else. But that's my 2 cents, and I'll leave it for you to think about. Question that came to Rob from one of our participants. Rob, this is for you. You have mentioned in one of your scenarios that the functioning commercial vaccine is likely to happen in 2021, later in 2021, and this will become more of a seasonal, annual virus that will hit us all. I think this question carries a little bit of fear in a sense, or, well, the question is that, can you shed more light on this?
Sure. I mean, these are based on our forecasts ranging, as I said, from optimistic through to nightmare. And as I said, we're moving into the pessimistic phase. And in that pessimistic phase, we have suggested that that the disease could become seasonal. But in any case, the fight against COVID-19 is going to depend on the discovery of an effective vaccine. There's no doubt about that. And there's a lot of work going on in those areas. Now, the time to market for a vaccine is, and has been for a long time, many, many years. Now, the most optimistic forecasts that we've heard are that a vaccine could be out within a year to 18 months. Now, if a vaccine is not ready for the market in that time, there is every chance that COVID-19 will flare up periodically. Still very early days in terms of understanding COVID-19. The EIU healthcare team is doing a lot of research in this area, and I'm happy to share that research as and when it's available. But there's still a lot of speculation about whether, for example, the virus is temperature sensitive. So, might it recede in the summer months? For those of us in the Northern Hemisphere, we're approaching that time, so hopefully. For those in the Southern Hemisphere, approaching winter, that will be bad news. But of course, in order to eradicate this, it needs to be fully attacked by vaccination. Otherwise, it remains in the population and it's likely to come back again. And we've already seen concerns in Asia, where, as we heard from Jeff earlier, there are very few new cases of COVID-19 emerging from inside some of the countries of Asia, China and Singapore in particular, but there are still cases being brought in by travellers, and those, of course, could trigger new outbreaks. So until a vaccine is ready and is deployed, there's definitely a chance that COVID comes and goes, and it probably, if it does, will come and go seasonally.
The question as well that just came in a very, in the 3 bullets, Jeff asked if you could say, why is it working so well in China, despite the fact that it spread the first and the foremost? Jeff?
I think containment and immediate containment was the success. I mean, and I think if you're living in Hubei, you probably would have a different view on the word success than outside of it. And I think we therefore have example of what not to do and also what to do. The rest of China immediately in those first 2 weeks went on full lockdown completely, and that has contained it within the province of Hubei, and the spread into other provinces, other cities has been very, very, very small, and therefore we've been able to keep it outside of all of the major population centers outside of Hubei province.
There was a question, I'm not sure if anybody is qualified to answer it. How do you see steps taken by the UK in this regard?
Am I the token Brit here on the panel? If so, I've certainly been paying attention to the daily press conferences from Boris Johnson, from the Chief Scientific Officer and the heads of Health England. Look, I mean, the UK has done what a lot of countries have done. There is massive fiscal stimulus being injected into the economy, £330 billion worth. The question will be, how quickly can that get out to small businesses and those that are facing cash flow problems? Monetary stimulus in terms of cutting interest rates, as you've seen around the world. The UK had a bit of room to do that. The US certainly had room to do that. Other places, Bank of Japan, European Central Bank, probably don't have room to do that. So in that respect, they had a little bit of leverage. There was some criticism in the UK about the slow decision to close schools, although that's now finally been announced as of tomorrow. Actually, I think that decision was taken out of their hands. Lots and lots of teachers self-isolating to the extent that schools simply didn't have the staff to enable schools to remain open. Interestingly, one news we did get yesterday is that schools will remain open for children of key workers. So that's in an attempt to ensure that hospitals and care facilities can remain open and that they don't, the employees of those establishments don't have to remain home with their children. So look, it's a fast changing situation. There's been a lot of criticism of the UK response. People think they should go faster and deeper. The medical advisors have been talking about ensuring that these responses are timely. So don't go too early. If you go too early with these things, they lose efficacy. So I think we're all waiting to see how the UK, how the infection rate in the UK pans out. We are behind places like Germany, France, Italy, but probably just lower down the curve. So I suspect it's coming. We will see how the UK's social distancing measures work and whether we flatten the curve more than we've seen elsewhere. But I think it's all still to play for.
All right. Thanks. I need, there are like 5 minutes. I'm going to try to get to answer as many questions as possible. Nick, could you tell us about what's your view? I have 2 questions for you, Nick, back to back. So Nick Lebushin, so if you could answer them quickly. One, what's going on in Africa? Are they doing it right, or why is it not spreading? If you think you have an answer, given that you're living now in South Africa. Second, SMEs, how are they going to sustain themselves in this environment, especially that this could be a double recession?
Okay. First of all, let's deal with Africa. I'm living in South Africa, so we have already taken some fairly stringent measures. The country is slowly going into lockdown. So in effect, all schools, universities have been closed, public spaces are closed. Restaurants and hotels are still open, but with restricted hours. There is a significant concern that if this breaks out into the informal areas, residential areas, that it'll run out of control. So the country is fully aware. It has put in some very, I think, sensible measures so far, but they have also explained to us that should things deteriorate, these measures will get ramped up quite significantly. Across the rest of Africa, the spread appears to be very slow. Now, the spread is measured by registered cases. So it's either a situation of cases not being tested, but being present, or the fact that there hasn't really been that much traffic, humans from the infected areas into certain parts of Africa. It's starting now to spread across Africa, and we're all very, very concerned because the healthcare infrastructure in most countries in Africa is abysmal. They don't have the capability to put in containment measures like you can in more sophisticated parts of the world. And invariably, there will be leakage from Africa into other parts of the world, making contagion that much more likely into areas that have already been contained. So that is a major concern for all of us. In terms of SMEs, I think that we are seeing, you're already starting to see this in the United States with the gig economy, with small businesses that are reliant on high footfall, and temporary workers are going to suffer terribly from this virus. Unless the government puts in measures either regulatory measures which allow non-payment of loans, non-payment of rents to be extended for several months to provide a cushion. I think that many small businesses will go out of business, and this is a dreadful thing, because anybody who has set up a small business themselves knows the amount of time and energy and, quite frankly, luck that it takes to get your business up and running. And to have your feet cut away from you suddenly like this, it's an incredibly difficult task to bring that business back up again, particularly if the infrastructure and the environment in which you operate is also suffering simultaneously. So I am not hopeful that the SME sector will bear this easily. I think we're going to see a lot of destruction there, and it's doubly concerning because the SME sector is one of the highest employers in any of the sophisticated economies.
Okay.
Can I just add?
Go ahead.
I just want to add one statement to Nicholas. I mean, that's what we've noticed here in China, that the SME sector is the one, you know, the small restaurant owners, the delivery firm, these are the ones that are really facing the challenges, and they are the drivers of the Chinese economy these days in terms of growth, and it's so across many parts of the world. And I note that I think we might get through this first blip, and then there's a longer tail of trying to bring the confidence back to the SME community.
Hello? Hello? Now, there is a chance that this is ended on time? No. All right, we can't hear what's being said right now, so let me see if people are still able to speak. Nick, can you hear me?
Yes, I can.
All right. In this case, I'm going to ask the very last question before we conclude, because there is so many questions, but I don't think we have time to answer them all. What is the role of the media in this time and age, given we're looking at, there is a question from a lady called Zaina about how the Lebanese media use this as a political tool. And also maybe in the early stages of Corona, many of the US media echoed noises in the government that this is a hoax and we should not take it seriously. So now going forward, how do we see the role of the media as a more responsible and being a more neutral part rather than being aligned with a party or another? Anybody would like to answer this?
Well, I'm happy to comment on it. I think, look,
go ahead.
You've answered to a certain extent by saying that it needs to be more responsible. To be non-partisan, I don't think we can expect the media to be non-partisan, but they certainly have a responsibility to reflect the facts of the situation as they're given to them by reliable and verified sources. This is a situation where you give people poor information or misinformation or deliberate disinformation, where people will lose their lives as a result of it. And I think that really is the role of the media at this stage. There's so much going on, there's such an impact on our societies, you cannot expect them not to engage in political discourse or political one-upmanship over how this has been handled. But in terms of public awareness and sharing the facts about what needs to be done in order to protect everybody, it's absolutely vital that they do not twist those facts to political gain.
Okay, well, we have many questions. Please feel free to email them to any of us directly. We will try to answer. I just don't want us to overrun our time. We promised you an hour. I believe this is a very informative session. We will share a recording of this session, so for people to look at it and ask further questions. And if you would like more information, more details, please communicate with us via email or by phone, and we're here for you. This is to conclude, ladies and gentlemen, thank you so much. As a communicator myself and run a communications agency, I see a huge role for us here to support private sector and government in order to pass on and transmit those messages that help people and governments deal with this this pandemic that we're all facing. Thank you very much for joining, and looking forward to the next session. Thank you.
Thank you.
Thank you.